Welcome in. So you've probably seen CBD advertised all over the place. You can get it at almost every health and nutrition store. Oils, vapors, don't get you high, but experts claim it can treat a whole host of ailments and even get you a better night's sleep. Lots of studies have been done on CBD oil derived from the hemp plant, and now we have spoken to a family who says it's working wonders with their child who has autism. So who's more nervous at a school performance? The kids or the parents?
Let's do it. It's gonna be a good one.
For Katie and Matthew Denton, the extra nerves probably on their side of the theater. Their 13-year-old son Slade seems to have this down just fine.
It's amazing. It's just been, I feel like it's been life-changing for us.
Slade goes to the North Florida School of Special Education, a life-changing place, the Dentons say. You see, Slade has autism.
He is so smart and he's so funny. I mean, it takes him a minute longer than you or I to process things.
She says he's very high functioning, very social, though as he's getting older, they've noticed his anxiety gets the better of him sometimes.
He would melt down, and I mean, we call it throwing a tantrum.
Something that would previously make performance like this tough.
And I was like, we have to do something because we can't live this way. It's torture for him.
So she gave CBD oil a try. She had been researching it on the advice of a client, and when they noticed his anxiety may be about to get out of control, they'll put a couple of drops of oil in his juice.
Within like 1 to 2 minutes, he was fine.
When I tell you that, were you surprised to learn that CBD oil would have helped a young man like him?
No.
No?
No.
That is Ponte Vedra pediatrician Dr. Ozdemir, and she is a big advocate for using CBD to treat various things, including autism. Now, the science of it all is pretty complex, but I'll do the best to break it down for you through the art of cartooning. So in the human brain, you've got billions of these neurotransmitters, things that are communicating back and forth. And within the transmitters, you have receptors that determine what chemicals get released, turned on, turned off. CBD, when ingested, it's a promiscuous molecule. Oh, but not like that. Meaning it doesn't exactly fit in with all of the receptors, but it certainly can have a reaction when it fits just a little bit. So for instance, it hooks up with a receptor for dopamine or serotonin. That chemical gets released and boom, it's anti-anxiety.
Because we know, CBD has an effect on the cannabinoid receptor.
How did it go? It went great.
A treatment that has given them a lot of relief, even though it's certainly not perfect or a cure-all. Katie says that for them, it's made all the difference.
You did great. Said we weren't gonna let autism take control of our life and not do anything for fear of him having anxiety or getting upset. And it's wonderful.
And it's legal in all 50 states. Lots of questions, though. For instance, will I fail a drug test if I take it? No. I mean, it's a derivative from the hemp plant. Will it get you high? No, it won't. And side effects or downsides? Certainly. So I did ask Dr.O, who we saw there in the story. She says if you use too much CBD oil, the biggest side effect you may notice is dry mouth.